Can you tell me your name and age?
My name is Ejanaya Everett. I'm 23. I've been at BMS for like, I don't even know how long, like a month or so.
A month or so.
And it's good. Like they treat the patients really good. But the only thing I think they need to work on is just like try to do like sonograms, like instead of sending them to the hospital, like it should be in the clinic. But everything else is like the doctors, everything, the nurses, they treat you very well. They treat you with good care. They have a lot of resources to help the mothers. But I don't know that much to say because I haven't been here for so long. But for so far since I've been here, they've been treating me very good. I have been helped with the WIC. I have been helped with different programs to help me with my baby, even with my daughter that I have now. But so far, like I didn't go into it like deep with them yet. But I really like it here, and I'm gonna stay, and I'm gonna keep them.
Yeah.
Yeah.
What brought you to BMS?
I had got recommended here, so it was like by a friend. So I got recommended here, and I tried it out, and I actually liked it. Also because it's convenient for me. Like I live down the block; it's not that far.
Oh, you live nearby.
Yes, so it's like easier for me to make it to the appointments and come home. So I just like them. They're very sweet. I don't know.
Yeah. What needs do you think has your community and other mothers just like you? They live in the neighborhood. What do you think are the biggest needs? Doesn't have to be health, can be something else as well.
I mean, I think the biggest, like everybody's biggest needs for the mother, I think it's a support team. Like you need a lot of people to support. Like if not, because there's some mothers that struggle that doesn't have anybody, and like when you have programs like this, it helps them very, very good to support them, and they won't feel like they don't have anybody, like nobody to be there. So I feel like they just need a real support system, like a heavy support system.
A support system, that's so important.
Yes.
And what kind of other needs do you have as a mother that impact your health? Like, example could be food or house or mental health.
Definitely food, because now with the shortage that we have for the milk for the babies, I feel like we need more support with that. Even though like they say breastfeeding is healthy, but not all babies take it. So I feel like we need more support system with the food. Like I don't feel like anything else, like, for me, in my opinion.
Do you think you caring for your health more now versus your first baby, or how do you feel now that this is the second?
I mean, I feel like I got it down packed now. Like I don't feel like I need any like help. Like I know what to do. But being pregnant again, it's like it is a lot because you have your first kid and then you have to do like not do what you did with your first kid, but you have to be more like, how do you say it? Like more prepared when you have your second kid. Like at the first one, I wasn't really that prepared because I had her very young. But now that I'm having my second one, I know what to do now, how to do it, what help I can get. Like I'm more prepared than I was with my first one. So I feel like everyone should be like kind of more prepared when you have like your second or your third kid. You should already know what to do, what you're missing, what not to miss. Like so, I feel like I'm more prepared now in this pregnancy than the first.
Is it easy for you to access services when you need them? Or do you face any barrier?
No, I say it's easier for me.
It has been.
Yeah, I don't face any barrier.
What would be your message to other mothers in your community to take care of themselves and their babies?
Huh?
What would be your message for other mothers in the community? What would be your advice?
My advice is like, even if you have no help, don't feel like you don't have anybody because you can always get help anywhere. Like, don't sit and be depressed or anything by yourself. Don't stress yourself. Like I feel like you can do it. Every woman can do it. Like when you choose to make the decision to have a baby, even if you don't have help and you choose to keep it, I feel like you're basically giving yourself that message where I can do it. I could be prepared. Like don't break down. Don't discourage yourself. Like I feel like every woman can do it, even if you're alone or with help. You still can do it. Like that's my message to everyone in the clinic.